Next one is going to be our knee immobilizer, okay? So this, we are totally locked in extension, no option for flexion at all. We want to maintain a straight leg. So this is our knee immobilizer, you guys. If you are ever confused, probably the most common question is what is the top, what is the bottom? If you hold it up and it looks like a butterfly, the wider portion, that's always going to be the top. That's always going to be more proximal because that's meant for your thigh as opposed to down here is what's meant to go around your calf. So if you can ever need to orient yourself, just hold it up and where's the top of the butterfly. Okay, so for this one, you guys, there's a couple different versions out there. The ones that we have most commonly in the closet, we have a handful of them, are actually adjustable knee immobilizers. Some of them are just one piece. These ones actually allow for you to take off the struts and move them based on the size of the patient's leg. They are able to be a little bit more one size fits all, so they don't have to carry different sizes of immobilizers at the clinic. So I'm going to show you how to put this one on. Your patient's knee needs to be an extension, obviously, when you're putting this on. So you can have them in long sitting, you can have them in supine, and when you're moving and adjusting your knee, obviously you're not bending and moving it in order to get this on, right? We need to lift it in that straight leg raise fashion so that it is supported and maintaining that straight position. So I will put this on as best I can, and then I'll kind of give you an over angle here. So there's two layers with these ones that they're adjustable. So there's this main slip underneath, and then this second portion is what's adjustable. So I can literally take this whole thing off and slide it. This is where the actual strut is. That is this hard metal bar. Okay, and that's what's actually going to give you the support and keep you into extension. So this is what I get to actually align based on my patient's, proportions and how they're laid out. So the little slip is what I'm going to have underneath here, and then I'm going to line up this strut exactly halfway through the side of my leg. I need to be on the lateral side of my leg, and it's going to be the same thing medially that I need to have this one on the medial side of my leg. So I can literally pull off the entire thing, it's just Velcro, and make sure that I'm lined up here so that I'm right halfway down. I should be able to see half of the top of my leg and half of the bottom of my leg. Okay, as I'm going down the middle. It should be lined up, kind of if you poke inward, I should be able to feel my epicondyles because that's right where it should line up with, okay? So as I'm doing this, you guys, same thing with our AFO and our layers here. I would ideally like my patient to have a layer underneath this, but it is not necessary. In some cases, there is such a thing as too many layers underneath. That puts us at a higher risk of wrinkling underneath and cutting off any type of circulation or causing potential tissue damage. So we don't want to do that either. With these, you guys, it's easiest to work your way distal to proximal. With this and with our hinged knee brace, the bottom hinge and bottom Velcro is always going to be our make it or break it if it is sliding up and down. The bottom one is the one that is determining and needs to be tight enough so this guy does not slide. So usually I'll work distal to proximal, and then I'll give one final pull on my distal one to make sure that it's tight enough, okay? So when we're coming here, I'm going to start with my distal. I'm going to fold my initial baby layers underneath. Okay, again, smooth, make sure there are no wrinkles. When I fold these over, you guys, I am making sure that I am aligned and my kneecap, okay, this one's a little big for me, but you can see, and then I'll hold you up here, okay, that I am aligning where my kneecap is sticking out of that little cross section there, okay, and it's on both of them, okay, they may not line up just right, okay, so it's just so that those curves are allowing for where your kneecap is exposed, okay, so you need to make sure those are lining up all right. As I fold these over, no wrinkles, nicely, fold one, great, here I come. This is the tedious part, okay? Just work your way up, holding in place, okay? As tight as you can go for now, and you can always adjust after the fact if you feel like it's too tight. Obviously, we never want to be too tight that we are cutting off circulation or causing any ischemia, but as soon as your patient stands up, it's kind of like their gait belt that you'll feel like it loosens a little bit. So it's always better to be a little bit on the tighter side when you're first putting it on, and once they stand and move around, it'll probably loosen up a little bit and shift a little bit. So I am making sure that I am still smoothing everything, folding everything over, keeping it nice and smooth. Oh, just take that off. Making sure my struts are in the correct place. Okay, everything is put down here. 1, 2, 3, okay. There's another one. Okay, my kneecap is still exposed here. Okay, that's what I've got going on right there. My kneecap right in the center here, okay. Next one, so there are 6 straps on these, you guys. Even the single layer ones have 6 straps. This thing, you're not meant to be moving or moving around in it. This thing does its job very, very well to keep you secured. Okay, even at the top here, if you've got some extra layers, just make sure you're smoothing everything out. You never want to have any funky wrinkles that could lead to compression and potentially ischemia. Okay, so now that I'm on, I'm gonna come back down to my bottom, my most distal portion. I'm gonna give it just a little bit of an extra tighten, because if that bottom one is loose, as soon as I stand up, that's what's gonna be the determining factor if I slide. So now that my patient has this on, I'm gonna double check everything. My medial and lateral struts, this is kind of a funky angle, okay? So my medial and lateral struts are halfway down the center of my leg. They're not too far anterior, they're not too far, and don't wrap around the back posteriorly, okay? They're right along that edge, right as if I were to dig in here and I feel my epicondyles, they're right along that line, okay? They cut my leg in half, okay? Right along like a frontal plane, okay? So when my patient goes to stand up then, I need to make sure that as they go to move, it does not start to slide down. Okay, you need to make sure that your patient can stand up, and if it needs to be adjusted, does it feel okay? Is it digging into you anywhere? With this one, you guys, they're pretty soft, they're pretty padded. Your patient doesn't have to have a layer on underneath because it is so soft and padded. And if they do, a very thin one will do just fine, okay? Minimal wrinkles. For these, potentially digging in here, if your Velcro is a little bit exposed, if it doesn't quite fit right, there's always kind of little paddings or little Velcro things that we have in the clinic that we can make small modifications. It's not something we need to run to the orthotist about or doc about. We have tiny little, fabric or something that we can rig to kind of put over it to make it more comfortable for your patient, okay? That is our hinge knee brace. Again, if I'm gonna be taking it off, my patient needs to be in a supported and extended position. Please make sure that every time you take it off, just like your ankle weights, that you are smoothing down so that it doesn't stick to itself. These things are notorious for sticking to themselves if you leave the Velcro unvelcroed, okay? And you will be untangling a mangled mess if you do that, okay? So take all of yours off and stick it back to itself as they come off. Bam and bam, okay? Again, top is the wide portion, butterfly. Top of the butterfly is more proximal, okay? Top of the butterfly. That is your knee immobilizer.